I just can't do it. I just can't seem to get any of my work done, any of my schoolwork. Just, I don't know. This has been for like so long. Nothing's changed. Nothing's changing. I just can't get anything done.
How long have we been doing months?
I'd say months.
So you don't think that you're getting very far here?
No, I still have the. I mean, yeah, sometimes it's better. I mean, it's been better, and but in the grand scheme of things, just no, just.
Okay, I'm going to stop right here for a second. Okay, so what do people? What goes through your mind about this interaction? Right, and the therapist, I mean, I was struck, I thought that was like a very, empathic read of that. However, what is happening, I mean, why, let's think of the theories we went through, okay? Why is the patient saying, I'm very frustrated about my work, and why does the patient not say, I'm concerned that we're not making progress, okay? That would be the therapist theory. Let's say the therapist is right for now. I don't know, but it sounds plausible to me. Why doesn't the patient say, this is what I want you to speculate about. Why can't the patient say, we're not getting very far. I'm concerned that this is a waste of my time and money. Why can't the patient say that?
I think that the patient is almost embarrassed to say, I'm paying good money and you're supposed to be helping me. And I also detected from...
Embarrassed? What do you mean by embarrassed?
He feels a little angry, actually, that he's here to do some work, and the therapist isn't helping him get from A to B, wherever B is. And I also detected, pardon me, but Mike was like very laid back when the patient was very animated and upset about his state of mind. I would have wanted the therapist to have a little bit more body language or more emotion.
And we're all beating up on this therapist today. All right. Okay. Yes.
Well, I wasn't sure if when he said, I'm frustrated about my work, I wasn't actually sure what content he was referring to, whether he was referring to the work in the therapy or I don't know what his
schoolwork.
I thought maybe it was also work at school. Oh, you said schoolwork? I missed that. Okay. So then I kind of felt like it could be that he doesn't have necessarily the insight that the therapy isn't working in a working way, and that he's frustrated that his presenting problem continues to be a problem.
So the first speculation is anger. He's angry. You did not say why being angry would cause him to talk about schoolwork instead of the therapy. You're saying, does he not understand how therapy works? What are other thoughts? This is the question. Why doesn't he just say, I'm concerned that we're not making progress? I mean, I came here to do better with schoolwork, and I have the same problem.
He's afraid the therapist will blame him.
He's afraid.
Afraid of being blamed, afraid of authority. Like if I tell the therapist I don't think this isn't working, maybe the therapist will say to me, well, you weren't doing X, Y, and Z.
So he's saying, I'm frustrated with myself, rather than saying, I'm frustrated with, that's really essentially what you're saying by anger. I'm frustrated with you, I'm frustrated with myself. Why is that a safer thing? I mean, why would he rather be angry at himself than at his therapist?
Because it's harder to confront. It's harder to confront and to tell the therapist that you are not doing your job. So people.
But why? Why is it harder to do that?
The fear that if he can't help him, then who can?
You don't risk rejection.
His father didn't encourage him, but his kid.
Okay, it's harder to criticize the therapist than himself because you said rejection? Fear. Fear of what?
That if this therapist is like a father figure can't help him, then who can?
Okay, so here's one hypothesis is that he doesn't want to lose hope, okay? That if I can't be helped by this therapist, then no one's going to help me and I'll be hopeless. Any other thoughts about why?
Told to talk in feelings. Talking about a feeling rather than a concern.
Okay.
I'm not convinced that he's necessarily in saying, I'm so frustrated that he's blaming the therapist. I'm not convinced of that. I don't know enough about the relationship, but it may well be that he feels that he's not doing what he should be doing, to follow through on things and take agency, that he has a sense that he's the one who's employed. I don't know what they
for the sake of our workshop, then let's just say that there are definitely patients we've all met who are unhappy with therapy and are concerned, and they have trouble telling us.
Yes,
and let's just, for the sake of this exercise, say that he's right. Okay. Why is that? I mean, I don't know. We didn't hear from you if that's really what's going on, but why is it easier to say, I'm just not making progress, I'm so bad, despite all this work you're doing with me, I'm not doing a good job, rather than, I pay you $200 a week, and I'm getting absolutely nothing done better than I was 6 months ago.
Because he's afraid the therapist will say, this is your resistance. It's safer to do.
Well,
Well,
I?
no, not yet. Okay. Yes. Fear of loss.
Fear of loss of the therapist, either by being terminated or the therapist won't want to invest in him anymore by some fantasy of his. I'm turning you off.
So not just loss, but also like making the therapist angry at me and hate me. Okay, that's like getting an angry response back. Yes.
Perhaps from a self-psychological point of view, the patient never develops a strong sense of self and always finds fault in himself and never blames himself anymore.
So then we'd want to work with that. We'd want to wonder, how does blaming himself and not saying openly, I'm worried that we're not making progress in therapy, how does this lack of sense of self lead to that phenomenon in the treatment? In other words, that's what I think, that's what I'm hearing you say. So how would a person with less of a strong sense of self end up saying, I don't think I'm frustrated myself, rather than saying, you're not helping me. This isn't working well.
How would you achieve that? How would you get to that point?
I'm sorry, I'm not explaining this, asking this well. I like your theory, which is that this is about basically a self-esteem issue in him. How does the self-esteem issue translate to him being unable to say out loud, I'm worried that the therapy isn't working, and to blame himself instead? Why does because low self-esteem causes other people to say, it's your fault, you're the bad therapist. If I had a good therapist, I would be doing fine. And that's what some people with low self-esteem do.
Are we assuming that it's an option, or that he's thinking of saying that? Are we assuming that he could say that there? Yeah. Are we assuming that the patient has the thought of saying it's the therapist's fault?
Yes.
Maybe that doesn't even enter consciousness.
Well,
perhaps
I think there's a range of views. I think some people think that stays unconscious, that there's something that's dangerous about criticizing the therapy. So what comes to consciousness is a compromise. It's that I'm not doing well in my work, I'm frustrated at myself rather than at my therapist. Just to explain something that you said, haughty, arrogant people with Gaiva problems, with narcissistic personality disorder, arrogance, haughtiness, Gaiva. Narcissistic personality disorder, as it's talked about like in the DSM-4, are people with terrible self-esteem, and they're compensating. The compensation is to, suddenly become arrogant and strong and blame others. That's what I mean. Now, he's not doing that. That would be one type of, you have a thought that this is a narcissistic problem, and because of his narcissistic problems, he can't think about blaming the therapist in some way.
Well, you're describing, I think, what they call the nasty narcissist.
Right.
But I think there's also the friendly narcissist, which is the narcissism is much more hidden and doesn't really come up that often. And perhaps I'm suggesting that the patient's sense of self is so damaged that he doesn't even entertain consciously to blame the therapist. It's all internalized towards himself.
Okay. So let's take two of these hypotheses right now, and we're going to give Moishi two possible Moishla. Okay. We're going to give two. Okay. One was anger. One was a fear of getting an angry reaction. Okay. The other is that he is going to avoid shame, all right? He's avoiding shame by taking responsibility. If he starts to blame the therapist for the problem, that's going to cause him to feel more shameful in some way. That is your, how would that change your intervention, all right, with the resistance? Do people follow what the question is?
I see you're splitting them, and I see the shame part more allied with the first interpretation. I don't know why you see it as two separate. I didn't feel that that's what you were saying. But,
well, okay, let me make this simpler. Let's go to the anger hypothesis. How would you intervene
Can you
if
explain perhaps why wouldn't a client want it? I mean, this happens all the time. Why is a client not confronting? Most times a client will say, like you're saying, I blame myself, it's not working. They'll say it's not working. They will not say, you're not doing a good job. I want my money back. That happens all the time.
well, and why does that happen all the time? Well, that's what, I mean, that's really what this whole exercise is about. I mean, that is that is a common form of resistance. This is resistance right now. The feeling in the patient, if this is, we're going to go with it just for the sake of the workshop, is he is disappointed in the therapist and he's unhappy. He's a dissatisfied customer. He comes off as a self-critical person rather than dissatisfied customer. Why? One hypothesis is anger, one hypothesis is shame and low self-esteem.
What about fear of confronting the client?
Well, it's fear of getting an angry reaction.
Well, fear, yes.
Why are you calling it resistance? Why isn't it just the client's afraid of fracturing the relationship with the therapist?
Well, because resistance is the word I'm using for any inability for the patient to freely communicate, is resistance. Now, fear of losing the therapist is an explanation for the resistance. Fear of the therapist getting angry at him is an explanation for the resistance. Fear of being shameful, because like no one's going to take me seriously if I blame my father for this problem. Everyone's going to know my father is one of the gedolim of our city, and any problems I'm having at home is going to be blamed on me, so I'm not going to blame authority. Those would all be plausible theories for the resistance. But it is, you know, we don't know yet. What we know is he's not freely saying this. So your intervention is sort of neutral in the sense, like, I think he's telling me that he's not happy with therapy, so I'm going to see if I give him permission to do that, what he'll say about it. That's your intervention at the time. If the reason were anger, would that be a good intervention or not a great intervention? I think that would be a better shame intervention. I think if this were a narcissistic patient, that intervention would make it safe. Listen, you're entitled to have an expectation. You're entitled to have an expectation that the time and money you devote to this is helpful to you. So I can understand why, if we're not making progress, you have concerns and you want to talk about it with me. Right? That I think would be reassuring. If it's anger, he might hear that as saying, are you insulting me? Are you telling me that you think it's my fault? It'll change the way we hear the resistance will color how we intervene. That's what I'm trying to point out. So what was your patient's, what was the patient complaining to you about therapy? Is that what was happening in this scenario?
Yeah, he definitely was. I think that in that case, he didn't want to say it was my fault because he valued the relationship. And
he was afraid of losing you.
I think the anger thing, not wanting to make me angry, was definitely a part of it. And I think he. I'm not sure I'm answering your question.
No, you are.
I think that was really behind it. Like he wasn't saying, you know, this isn't working. You know, but he was sort of.
So afraid of losing the therapist. So that's really, which of these modern theories is that most similar to?
Object relations.
Yeah, that's an object relations hypothesis about why this patient is being resistant at this moment. Okay, so we have 20 minutes left or so for maybe the third team. Thank you very much. Well done. Thank you. Okay, you are the therapist or patient?
Patient.
Okay.
I can say a little bit in advance. He's somewhat of a provocative patient. I don't know how far we're going to get into it, so I hope I don't offend people in terms of language or thoughts. So.
Okay, I'm a provocative therapist.
Good. Nice to meet you.
Okay, we will ask you to have the same assignment. At some point, the first time you remember your patient, this is what I'll do. The first time you remember your patient acting in a way that it gave you a hard time, okay, I would like you to try to channel your patient and act that out. And you don't have to know anything, or you can just tell us what you would do with this little information, how you try to handle it by acting it out back. Try not to break character. Try to just do the role play.
Great Shabbos. Really, really great. Rosen's invited me for Friday night, and I'm really friendly with their daughter. She's like 14.
How old is
Really cute.
How old are you? And the patient?
I'm 40.
Okay.
You know that?
All right, let's stop for a second right here. Okay. I mean, that's the best illustration of how we'd react, right? Okay, what's happening right now? What's happening right now? Okay.
Something that's very disturbing to you, and you like think, oh my gosh, what am I going to do now?
Okay. Now, is there a way to think of what is this patient doing? Forget about the 14-year-old girl for a second. What is this patient doing to the therapist right now? What's Okay, so I heard provoking, trying to provoke, and crying out for help. I mean, these are all consistent with one another. Yes.
He's disarming him by talking about it in such a casual way that you wouldn't dare say, like, hey, what do you mean? She's 14 and you're 40. Like,
He's definitely not crying out for help, though. I have to disagree with that.
It's great, it's a great challenge.
Why did he have to mention the girl?
Well, it's what is your reaction? And I honestly don't know to what degree I'm projecting my shock and horror and like, what on earth have I gotten myself into by treating this guy? What am I? I don't. When you were quiet and you sort of like. It looked like this is what I'm imagining. 3 times you were maybe going to say something, and you didn't say something, like sort of, That's what I sort of, is that what you were feeling like in the moment, or am I imagining that?
I was thinking about saying, what do you expect me to say to that?
Right. What am I going to say? How am I going to work with that? That was, what would be stirred up in you? I mean, I felt like he captured exactly how I would feel hearing that.
You can wait a little bit.
What would be
I was a little bit, shocked. That was what the scream was about. But I'd also first have to determine, like, how aware is this client that they know that there's actually something wrong? Like, there's some people who would literally go in there and their sense of morality, their sense of right and wrong is so, like, they're not even, or such like a dot conscious of it. And then there's some people who really go in there, and I'm saying it, but I'm really aware of, like, how off this is.
Okay, so all the people that are saying provocative or crying out for help think that on some level this man knows very well. On some level, whether it's conscious or unconscious, he knows very well that most people would be extremely uncomfortable and disapproving to talk about sexual excitement at a Shabbos table where you're invited by a family to their 14-year-old daughter. And I think that is an assumption a lot of people are making. If that's not intact, okay, then we're talking about some sort of different diagnosis, a developmental, like an autistic spectrum disorder or a pervasive developmental disorder or psychosis. But I think that's sort of the assumption is that this guy knows that, he would not say that also to, someone. He knows that there's something wrong with that. I think that's the assumption people are making.
Can I just make a quick announcement? Anybody who's getting CE or CU credits, if you can sign in and out. Nope. Okay.
Thank you.
It's in the back.
That's I think an assumption we're making for the exercise. Yes.
assuming that that was the case, I wonder what it would be like if the therapist at some point would say something like, I wonder what you imagined or what your fantasy is of how I would react to what you're telling me.
That's exactly what I was gonna.
That's what you were trying to find a way to say.
Yeah, exactly.
Now, what?
Can you repeat that? What did you say?
I'll repeat it for you for the tape because they want to hear it anyway. So what he's wondering is, could you find a way as a therapist to say, I'm wondering how you think or how you imagine I am going to feel or react to hearing about this sexual excitement you're sharing with me about this 14-year-old girl. I'm wondering if you had concern in any way or how you imagined I would react to hearing that. That's in a sense. Now, I think that's very hard to do unless there's a frame in the therapy where that's included. So this could not be the first time that you ask a patient that kind of question. If you've developed a frame in therapy, which is very easy to do when free association is the rule. It's very easy to do because when patients can't free associate, the reason is usually, well, I imagine if I say this, you're going to think that I'm a pervert. Or I imagine if I say this, you're going to think that I'm nasty. Or it's like an impolite comment about you that I don't want you to hear. So they have naturally included that into the material when it's conducted according to free association. But if the frame isn't there, I think it's very hard, even for this exercise, it's hard to formulate words like that if it's the first time.
It's simple. I say, well, what do you expect me to make of that? It's trying to provoke me into a response, but I'm not going to let myself get provoked. I'm not going to let him make me pigeonholed. I'm going to make him tell me what I should think instead.
So why don't we just
let him be the one with the problem.
Should we continue this?
Yes, we can continue this. Okay. All right, go ahead.
What do you think I should be making of that?
What do you mean?
What do you think I should make of the fact that you're sexually interested in a 14-year-old?
No, I'm not sexually interested in her. I'm being very careful not to be inappropriate with her. In fact, the 16-year-old daughter, who I used to be friendly with, I see that she's a little bit uncomfortable around me. That's the way it goes with some girls, And so, I'm pretty careful with her. In fact, it often comes out that she's not home for Shabbos when I come.
Hold on a minute. I wonder why she's uncomfortable with you. You seem like a nice guy.
I think that's, that's just the way it is with some girls. They get older. It's, they're from the Beis Yaakov community. That I'm from the outside, and it's, they're just, I guess it's tznius or something. That's what it is.
Is she concerned about speaking to all adult men because of tznius?
I don't know. She doesn't come anymore.
She doesn't come when you're there?
The parents kind of probably just, send her off to a friend or something.
When you're there?
Yeah.
Do they do that whenever other people come visit also?
Probably. Why would I be any different?
Well, that's what I'm wondering.
Okay, let's stop right there. Stop right there. Stop right there. Okay, everyone smiling and clapping. What is going on inside you as you're smiling and clapping at this? Why are we all enjoying this so much?
It's fun, but I think he's got some sort of autism. Little autism.
That's why we're enjoying it so much, because he has some sort of right.
He did a great job.
He did a great job in portraying it.
But we're not enjoying.
No, we are enjoying this. What do you mean? We're not enjoying that this is happening, but we are enjoying this exercise. That's what I'm saying. Why are we enjoying this exercise? What is this stirring up in us?
I'm horrified at the parents. I'm wondering, my mom was like on the pad, where are they? Like, there's anything off their 16-year-old and the 14-year-old is in the house. Like, who do I call to let them know that this child's in danger? I guess like my reaction is that I wasn't thinking about situations in this sense.
Does anybody think he is crying out for help, or do people just think he's like clueless, like autistic clueless?
At this point he's crying out for help. At this point he knows.
And what's the help he's asking for? This was your hypothesis all along. What help does he want?
He wants, he's like in conflict between becoming aware of his problem and not wanting to. like running away from it and bordering finding out.
I need to protect the girl, and she wants to go protect it against it.
Maybe he's trying to test me to see am I gonna push him, and then he'll defend himself, so he can sort of, like you said, reinforce it even more.
If you really wouldn't, if you would be like really interested in this behavior, he would not mention. He would consciously make it his business to not mention.
You wouldn't bring it up.
Anything about him having a relationship with her.
Okay, if we're going to get to you in 1 second. If he's crying out for help, okay, those that disagree, just go along with me for a moment, okay, Janice? So if he's if he's crying out for help, you know me, I can do that with you. If he's crying out for help, what is the resistance right now? What is the resistance? What can he not say directly?
Fear of consequences, fear of rejection.
I enjoyed it. It's fun.
One at a time.
This is what I wanted to say before, that I think he's ashamed to say that I'm a 40-year-old man, and I really don't know how to have relationships, an appropriate relationship with someone who will be appropriate for me. And I'm feeling very uncomfortable with that. So I think there's a certain amount of
Shame over
shame and
failure in love relationships.
feeling incompetent and
Incompetent as a man.
Yeah.
Incompetent as a man. Okay, that's your theory. What someone said before you said anything, or before you finished, that's way too far. What was you think it's a more primitive problem?
I think that, I don't think he's in touch yet at all with his shame. He's far beyond shame. A person who could, if he's so low with himself, he's not even thinking shame would be too much of a high expectation to even think now. He's now, he feels deep down that there is something wrong, something in his behavior, something is telling him, I am not on the right track, but he's afraid of rejection. He knows deep down, he knows the consequences, he knows...
The other hypothesis, if I heard it, is that he's afraid to say, like, I'm out of control sexually, and I need someone to put handcuffs on me or someone to monitor me. Like, is that the other? People are nodding. So these are two, I mean, these are not inconsistent necessarily, but one is like the failure in manhood, right? Like he's castrated or just inept as a man. And the other is like that I feel like in some way, like I can't control myself. I'm a pervert or I'm just out of control. And
I think it could be both, except that I think this would be first, and then...
Okay, but then, so here's the question. Let's say it's a lack of manhood, all right? If that's what you think he's coping with, okay, how would it change your intervention? So you've gotten to know this guy. He's constantly trying to be cocky and brash, and he gets into arguments with people and always wants to be like this big, strong man, and he comes across as an obnoxious little twerp. And when you hear this, you see this as another sort of like, bravado, like this sort of bad attempt at being a man. Would it change? Tell us, let's hear it in that way, and now tell us your response.
Well, it depends on...
Well, no, try to just act it out.
If I can say first, it depends on whether he sees that as being a problem. Okay.
Right.
So what was the last question? What was the last question?
You were asking me whether it was normal to talk or the girl, the 14-year-old, the Rosen girl.
Let me ask, how are you with having nice good relationships with cute 40-year-old women?
Well, I brought in those Facebook pictures before. When those times that I go to Chabad on the Gold Coast, I meet some really nice women, but they're all, I don't know why they're not married. Some of them I know why they're not married. They're not taking care of themselves. But other ones, I think every woman, they have basic things that they have to take care of, but some of them, I don't know why they're not. They're beautiful. They're bright. They've got good jobs, and they're just wasting their time. I say hello to them, and I introduce myself to them, and even tell them let's go out or suggest let's go out, and you know, maybe they'll go out once or twice, but nothing ever happens. They just can't commit.
Okay, let's stop for 1 second. He had a very different kind of response now, right? If we're thinking that like this is, you know, we're going with your hypothesis now. He had a very different kind of response. How does it make sense to you that it shifted the therapist's response now? He wanted to hear more just about, you know, I think that you asked the question in a way that encouraged him to talk more and more about what's going on with these young girls. As opposed to getting into like, you know, don't you know that I'm going to be outraged at hearing this? It's a different kind of response now, I think. Why did his response change?
The therapist?
Yeah. We gave him a task, which is to hear it in the manner of a person who is deeply ashamed of his lack of manhood, his lack of any achievements in love and sex relationships. And his response changed. You thought? No, the therapist's response changed. Yeah.
What's striking to me is, rather than talk about himself, he's talking about the women. He's talking about someone else. So it could be that the question is too threatening to him. Therefore, he has to avoid answering it directly about himself. And so it moves on to women. The problem is with the women, not with him.
Well, that's another form of resistance. In other words, he's using the women. He's using these women who are not taking care of themselves. They're not far along. I don't know why they're not married. They just don't do these things. I mean, it's another compromise in his ability to express what he's authentically experiencing.
And I don't know why they're sending home that 16-year-old. It's the same, you know.
I hear it's the same. I hear it's a continuum.
He did it initially too.
Right, but the question was the therapist, right?
Yeah, the question was the therapist. I'm asking the therapist, right. I think that...
He moved to ask a question about the 40-year-olds, and you wanted him, your task was to make the assumption that he's lacking in a sense of manhood.
Yes. And what will you talk about now?
And to me, that may be actually confronting him instead of reaching out to him.
Well, okay. I'm going to now give you a different task, okay? I'm going to give you another task. I want you to come up with a time in the therapy where did this patient at any times ever get very angry with you, unhappy with you in the therapy? Not really? Rarely angry. Okay. Just portray another vignette where you found it as a therapist very difficult to know what to do, how to respond, or what your approach should be.
They let go of me again. I don't know what it is. I've worked at such crappy jobs for so long, and I do my best. I show up on time, and they told me not to come in. I saw that place put out they put out an internet ad in a bulletin, and they were looking for my position. And when I said, hey, you're advertising my position, they said, go home.
I'd be furious if that happened to me.
Damn right.
Okay, let's stop here for a second. I'd be furious if that happened to me, he said. I'd be furious if that happened to me. And he said, damn right. Back. Yes.
And I'm sorry again. I'm trying to.
I think the therapist should have explored the patient's feelings rather than expressing what his feeling would be were he in that position.
Okay, so I'm not sure
He may have felt perhaps furious, but he also may have felt inadequate and disappointed with himself.
Okay, so I don't have the same response as that, but that I do hear your point. my sense is what was happening in the therapy, first of all, we have a different feeling. Don't we have a different feeling about this session than the first one? Right? Why do we have a very different feeling about this session as therapists now? Why do we have a different feeling about this session than the first one? We feel his pain, and he's talking about his pain.
And his vulnerability.
And his vulnerability, and he's not...
clueless of what really why it's happening. You see how clueless his behavior. He is not in touch with how his behavior is affecting other people. He's not in touch with how his behavior is affecting other people. And you really see that he's unaware, and it's a very vulnerable position.
He's not ready to accept the problem is with him.
I don't know if he's not ready, but I think he really is
well,
unaware.
Well, none of us, I mean, one of the things, I think what we're moving into in this case is a self-psychological formulation. Shame was one of the first formulations. A sense of a lack of accomplishments in manhood in the sexual arena was another one. Now, even if he's got an autistic spectrum disorder, believe me, people with autistic spectrum disorders are coping with enormous shame, sense of failure, and narcissistic problems, terrible narcissistic problems, even if they do have some sort of social cueing processing problem and there's like a deficit there. They are coping with terrible narcissistic injuries. And I think that the intervention is to try to articulate, you know, like, the resistance is, he's not saying, you know, he says, I'm confused. They didn't tell me this, they didn't tell me that, they didn't tell me this, they didn't tell me that. What's he not saying by all those things? What's he not saying? You know, why, they didn't call me, they didn't do this, they didn't do that. He's not saying,
I don't understand why.
What did I do?
well, he is saying, I don't understand why, I think. I'm devastated by this. I'm absolutely devastated by this. I'm mad at them. I feel like a failure. I think you said, I got let go again. Wasn't that the first thing? I got let go again. This is another in a long series. Your comment, well, you jump to anger. There might be many other feelings other than anger, is also true. But the therapist is trying to help the patient see certain feelings in this that he's avoiding by, you know, they didn't tell me, they didn't do this, they didn't do that. He's focusing on the inappropriate way that they let him go, not able to own the fact that he probably made them all feel so uncomfortable they don't know how to deal with him, and they're probably very weird in their dealings with him because he's very tough to deal with. Yes?
I just want to comment that when I'm faced with someone like this, sometimes a terrible sadness comes over me because I feel there's so much that needs to be done, and there's and I feel so sorry for them because they've got so many deficits in so many areas, especially let's say if it is an autism spectrum disorder where there's so much work that needs to be done. Just saying that as my counter transfers would be, this poor guy.
Right, we all feel now a sense of sadness for him as opposed to horror, right? And I think that is one of the things all these portrayals have been great. You know, the range of feelings that get stirred up in you. We were horrified and angry at the parents, angry at him, ready to smack him on the head, speechless. Now we just feel like, you know, it's like Nebuch, this poor guy cannot make a go of it in any, you know, he's grasping at straws to try to somehow hold on to some way to feel good about himself. That's what's being stirred up now.
I felt a little sorry for him in the first vignette as well. I felt it really, I mean, I felt there was a sense of bravado, but I did feel it was a little bit clueless.
That would probably enable you to work with people like that better than some of us can, because a lot of us are very consumed. Well, first of all, we now have medical legal things that we have to worry about. It makes it very hard to be a therapist.
That was my first thought. I was thinking, what is this going to lead to? Like, is it going to be that? But I also felt like I felt sad.
No, I think that's a real gift. And if you talk to the people that can work with people that, you know, really have impaired judgment or lapses in their sense of responsibility sexually, that people that can find the sadness in themselves for them and don't get consumed in, you know, being an advocate or being angry or outraged, they can do much better work. People that are outraged can't do great work. If you're outraged by your patient, you can't work with your patient.
The difference also is I was not that he has a sexual interest in young women, as much as that it's his whole persona how he's coming off inappropriately. And I mean, I don't know him, he's not my
Right.
client.
You're open-minded that nothing terrible happened or is about to happen.
I wasn't going to go to that horror yet.
You're not scared yet.
You know,
You're not scared.
Right. I'm open-minded to see that maybe this is a pattern through his different, you know, like has this bravado, he'll just speak to young women and he doesn't think anything's wrong with it. And that is a problem as well, because obviously he can't relate to women his own age, and there'd be a reason to explore that as well. But.
Okay, so we're going to wrap it up. I have a couple closing comments. I want to thank this group also. Great job. So the thing I wanted to get across would be that in these moments where, you know, we find it very tough to know what to do, the work feels very difficult, the patient feels like not collaborating or very, our sense as if you can think about, okay, what is the patient unable to say right now, avoiding saying, avoiding expressing, and why can't they express this? It is going to come down to fear of loss in a relationship, a profound sense of shame and grasping at straws to bolster up self-esteem, aggression and anger, or these modern theories, it is going to come down to one of these things. I mean, these are the basic sort of building blocks for understanding what motivates people and what gives them difficulties. If we can apply that in the moments of the resistance, I think it makes it much easier to know how to respond and what to do. And it'll change your response. Over time, as you get to know patients well, you become much better with their resistance because you know them. You know why they're not talking. You can imagine and you sort of think about how to intervene. That's the purpose of the exercise. I really had a wonderful time myself. Thank you all for participating.
In the second group, if I can just ask you, is it the fear of change? Does that have anything to do with not wanting to change therapists?
The second group of
changing it with being a student and saying, I'm not going to do my work, I can't. So,
well, I wasn't sure if he was afraid. Well, I think patients do want me to like them, and they care a lot about me, and they're afraid if they express. I think it's a form of attachment behavior. I think that, you know, like in primary attachments, I mean, the way I get people to nurture